So today I'm going to be discussing endometriosis and what that kind of looks like with a patient that suffers from this disease. So endometriosis is a chronic and often painful condition where the tissue that is similar to that of the lining of the uterus has begun to grow outside of the uterus. This abnormal tissue is normally found on the ovaries, fallopian tubes, and the lining of the pelvis. There's also been a few cases to where it can appear into other parts of the body. So similar to the normal uterine lining, this abnormal tissue thickens, breaks down, and bleeds during each menstrual cycle. But since it is located outside of the uterus, the blood cannot exit the body. And this is going to lead to the inflammation, irritation, and formation of scar tissues that patients who experience this have. So when the ovaries are affected, cysts known as endometriomas can develop. This disease can cause significant pelvic pain, especially during menstruation, and can also lead to fertility problems. And although there's no cure, there are various treatments to help manage symptoms and improve a patient's quality of life. So an anatomical overview. So this condition is going to occur primarily in the pelvic region. So these atopic tissues are typically found on the ovaries, fallopian tubes, uterine ligaments, and the pouch of Douglas. They've also been found to extend to extrapelvic sites such as the gastrointestinal tract, lungs, or the bladder. So this condition is going to be classified as ovarian, peritoneal, or deep infiltrating endometriosis. There's also endometriotic lesions that can appear in different colors. You have red that is actively affecting, there's white that's fibrotic, and then there's black, which is scarred forms. And this is just going to reflect as to what stage the disease has progressed to. So as you look down here at the bottom, you have what a normal uterus looks like. There's no sign of endometrioma attached to the fallopian tubes or the ovary, but when you come over to the endometriosis side, you can see on the outside of the fallopian tube and around the ovary, you see the endometrioma affecting that. So the pathophysiology of endometriosis is so this disease is not fully understood, and there's not a single theory that explains all cases together. But what is most widely accepted is the Sampson's theory of retrograde menstruation. So this just suggests that during menstruation, viable endometrial cells flow backwards through the fallopian tubes into the pelvic cavity. So these cells then implant, grow, and trigger chronic inflammation. But since retrograde menstruation occurs in several women who don't develop endometriosis, there are additional factors that need to be contributed for this disease. There are also a couple of other complex theories to go along with the retrograde menstruation that kind of suggest that there is endometrial cells that are affecting the patient, as well as immune system dysfunction that's going to allow these abnormal cells to survive and grow rather than be eliminated. But altogether, these mechanisms contribute to the development, persistence, and symptoms of endometriosis and disease progression. So the diagnosis of endometriosis is typically going to be delayed by 4 to 11 years after system onset. This is due to the lack of specific diagnostic tests with a wide range of symptoms that are going to be able to mimic normal menstruation discomfort. But diagnosis is going to begin with medical history and a physical examination with key indicators such as pelvic pain, infertility, and family history. So the gold standard for diagnosis is going to be a laryngoscopy, which is going to be the direct visualization of lesions and histological confirmation through biopsy. However, laryngoscopy is invasive and it does carry some risks. So this is going to lead to the increased interest of the non-surgical methods. So that's going to be the transvaginal ultrasound and the MRI. So the ultrasound is going to be particularly more effective in detecting ovarian endometriomas and some deep infiltrating lesions. There's also going to be some genetic biomarkers such as the CA125 that is typically elevated with patients with endometriosis, but it's not specific enough to be used alone for diagnosis. But overall, this diagnosis does rely on a combination of clinical evaluation, imaging, and sometimes surgical confirmation. So as for treatment and prognosis, typically the first line of treatment is gonna be the use of nonsteroidal anti-inflammatory drugs such as your ibuprofen and naproxen to relieve menstrual pain. There's also gonna be the use of hormone therapy that's going to be used in order to reduce the estrogen levels and slow disease progression. So that's going to be the hormonal contraceptives and progestin therapy. There are also patients with more severe symptoms or infertility, and there are surgical options to be considered. So the more conservative approach is going to be the laparoscopic surgery that's going to remove the endometrial lesions, and this is also going to help improve fertility outcomes. And patients who do go through this and who are wanting to get pregnant afterwards sometimes use the in vitro fertilization or IVF to be able to help boost their fertility. But there's also the more advanced or more last resort surgical procedures such as the hysterectomy, which is going to be the removal of the ovaries. So the prognosis of this diseases, although the treatments can be effective to manage symptoms and improve quality of life, there is again no definitive cure, and reoccurrence is common even after surgical procedures. So, early diagnosis and an individualized treatment plan is going to be what's the most important in reducing complications such as chronic pain and infertility. So, here are just some examples of ibuprofen and naproxen that is used, along with some hormonal contraceptives of birth control. So the third article or the third reference that I was reviewing really was able to express that endometriosis is a chronic condition that's going to cause this abnormal tissue to grow outside of the uterus, and is going to cause things like inflammation and infertility to those who experience it. And this disease has multiple contributing factors. This is going to include that retrograde menstruation, immune dysfunction, and genetics, and that diagnosis is often going to be delayed due to several nonspecific symptoms. It also goes into detail explaining the anatomical impact, showing how the lesions form on the pelvic organs like the ovaries and fallopian tubes that lead to the scar tissue, and structural changes that are going to impair organ function and fertility. Though there are still some questions that remain as to how these cells are able to survive in an abnormal location and why symptom severity does not always match disease extent. So more research is going to be needed to improve early diagnosis and understand disease progression per patient. So again, like I mentioned, endometriosis is complex and a chronic condition that is affecting several women across the world and can severely impact quality of life. So, despite having advances in research, the exact cause of this disease is unclear and diagnosis is delayed due to the lack of definitive non invasive tests and the various symptoms that one can experience. So, management is going to focus more on relieving symptoms through medications, hormone therapy, and as a last result, surgery. But again, there's no cure, and reoccurrence after surgery is common. So, having individualized treatment and a multidisciplinary healthcare approach is going to be essential for improving outcomes. So, continued research is needed to better understand this disease, along with creating a more effective long term treatment based on each patient's needs. And here are my references.